Okay, my name is Lorena-terapia, and today I'm going to talk about massage therapy. So first, we're going to start with an introduction. So people use massage therapy as a complementary and alternative medicine for a variety of health-related purposes, from treating specific disease and conditions to general wellness. I'm going to talk about the definition of massage therapy. Also, we're going to be looking at the types of massage therapy, benefits of massage therapy, effects of massage therapy, and when not to use massage, because there are some times where we cannot use massage therapy. So we're going to be talking about this. And finally, we talk about expectation during the treatment. Okay? So let's move on to what massage therapy is. There's many definitions of massage therapy, but I'm just going to talk about just two definitions. So according to an article titled National Center for Complementary and Alternative Medicine, found in ncncm.gov, massage therapy has many different techniques that it uses to manipulate muscles and soft tissue. Another definitions that the practitioners use is pretty much the same, which is in manipulation of the muscles. So as we can see, both of them are pretty much the same. Massage therapy is talk about how we manipulate the muscles and the tissues, the soft tissues of the body. Alright, now we're gonna move and talk about the types of massage therapy. There are over 80 types of massage therapy. I'm just gonna talk about some of them, because 80 types of massage therapy, that's too much to talk about. One thing about these massage therapies is that they're pretty much the same. The only difference is between them is the pressure that they use and the friction of the hands in the body or the muscles. Okay, so we have the Swedish massage. The therapist uses long strokes, kneading and friction of the muscles, and move the joints to aid flexibility. The deep tissue massage. The therapist uses patterns of strokes and deep finger pressure on parts of the body where muscles are tight or knotted, focusing on layers of muscle deep under the skin. So pretty much is just pressure in the where we have knots in the muscle, because there are too, I don't know, maybe stress, or it's just that. So the massage release that knot that we have in the body. Pressure point massage. The therapist uses a variety of strokes again, but applies deeper massage in the muscle. We have the shiatsu massage, and this is a little bit different because they focus on part of energy that the body has. It's a point that our body has, and by using the massage, it gives us that point of energy. Okay, now we talk about the type of massage, and also these types of massage, they have some benefits. So we're going to talk about the benefits of massage therapy. The first is relaxation, of course, because we're touching the muscles. giving massage to the muscles. The massage provides stimulation of the circulation. It also helps us block the pain signal sent to the brain. Improve sleep because you relax. Increase the flow of lymph. What this means is the flow of the circulation through the body. Shift the patient's nervous system. Now we have to talk about the benefits. I'm gonna go to talk about when not to massage and the side effects of massage therapy. Alright, so when we have a blood clot in a deep vein, we're not supposed to have massage, because a clot means there's blood stuck in the circulation, and if we have massage, it's gonna affect the heart. When we have a bleeding disorder, when we have damaged blood vessels, when we have fever. Why we cannot have massage when we have fever? Because when we have fever, that means there is infection in the body, and we're gonna spare that infection through the whole body. A tumor, an infection, cancer because it can, for example, if you have cancer in a leg, it's gonna maybe pass it to the heart or to somewhere else in the body because of the circulation. And when we have heart problems. Okay. Some of the side effects of massage therapy, if we get massage, is that we might get bruises, or we might be allergic to the oils they use or the powder they use to manipulate the muscle. But it's nothing major. Expectations during the treatment when we go to a massage therapy. So it just lasts 30 to 60 minutes when we have these like sections of massage. The therapist is gonna tell you about the series of appointments that he's gonna have with you. He's gonna check the symptoms if you have any symptoms. He's gonna go through medical history, evaluation through touch. He's gonna touch you and see if you have any pains in your body. Of course, if you have pain that you cannot support, he's gonna tell you that you cannot have massage until you heal. He's gonna use oil or powder, and he's gonna give you some recommendations when you finish the section, the massage therapy section, that you need to follow. Alright, so now we're gonna go to the conclusion. So we talk about the manipulation of muscles, which is the definition of massage therapy. We talk about different types of massage. They pretty much have the same techniques. It relieves tension, stress due to injury. It can also be used as an alternative medicine for a diversity of health purposes. There are some side effects of massage, and the therapist is gonna make sure that you receive the correct massage. And there's one other thing that I forgot to talk about, and the conclusion was the side effects that we need to be aware of. And this is pretty much it.